Hello, everyone. I'm Tanya Rivero. Thank you for joining us. We are following breaking news. The United Kingdom is heading back into a national lockdown. Prime Minister Boris Johnson said the way the new, more contagious strain of the coronavirus is spreading is, quote, frustrating and alarming. He said hospitals are more overwhelmed with COVID-19 patients than ever. Under this new lockdown, schools will close and students will once again learn from home. Over 50,000 new cases of COVID-19 have been reported in the UK for 7 straight days, and the rollout of another vaccine will not be immediately effective in stopping the spread. The new lockdown will be in place until at least mid-February. CBS News senior foreign correspondent Elizabeth Palmer joins us now from London. Hi, Elizabeth. Can you give us some clarity around these new rules?
Yes, well, it's brand new to me, too. So the highlights seem to me that overall the big message from the government is stay home. Just stay home unless you have a really pressing need to go out. And people who are vulnerable in any way, for example, who'd had recent chemo, who have chronic conditions, respiratory disease, they have to shield again. So have no contact with other people, have your groceries delivered at a distance and that kind of thing. And a very big thing for a lot of Brits that schools and colleges are going back to online learning. Daycares, really little kids, will be able to continue going to their institutions, but primary schools, secondary schools and colleges are going to be closed again, and lessons will be given online. Outdoor sports, organized ones, football, tennis and so on, golf, band. But interestingly, they've left churches open this time, as well as playgrounds. And we had for the last few weeks the ability to go to a pub and not be in the pub, but get a plastic glass of beer to take away. And they're shutting that down, too.
So how much of this is a direct response to the new, more contagious strain that we're seeing in the UK?
100%. We've seen the number of daily cases double from just before Christmas to now. And although the death rate is not as high as it was in the spring, because we're much better at treating acute COVID, particularly among the elderly. The hospitals are really groaning under the strain of many, many sick people. And this is, after all, the worst time of year for hospitals anyway. There are seasonal colds and flu and that sort of thing. And so this is really an attempt to stop the hospitals from collapsing, something I know that you worried about here and there in the United States, in order to provide medical care for everyone who needs it and not have to resort to things like, helicoptering people around the country and that sort of thing when they're very sick.
Sure, and having to make decisions about who to treat and in what order, which is just horrible position for any medical professional to be in. But of course, this is another major reversal for Boris Johnson in the past several weeks. How are people in the UK reacting to this, particularly parents? Are they blindsided by the school closures?
Very much so. Look, until Friday, the government was insisting that the schools would open. And teachers' unions and certain local areas were pushing back, saying, we don't want to do it. It's too dangerous. And the government said on Friday night at close of business, that's it. Everybody's going back to school. So you can imagine over the weekend, this reverse, this U-turn has left a lot of families blindsided, as you say, and in a fix. So they're not going to be very happy. And people are generally losing patience with what seems to many to be a hesitant, too little, too late strategy that has, got us in the top tier of deaths and cases since the beginning of this outbreak. The one thing that is notable about this is that there seems to be a bigger logic and a plan, and it goes like this. The new AstraZeneca vaccine was rolled out this morning. They're going to ramp up the mass vaccinations, and they say that by mid-February, all the very elderly people in care homes, nurses and doctors and so on, will be done. And so by mid-February, the most vulnerable will be protected, and then they can start rolling back. And that, to a lot of people, will sound like a plan, which is what everybody's been waiting for many months now.
That does sound like a plan. Well, Elizabeth Palmer in London, thank you so much for joining us.
Pleasure.